Hi, my name is Dr. Elizabeth Eversull, and today I'd like to talk with you a little bit about migraine headaches and some options that you might not have heard of in terms of treatment and prevention. Some people are not quite sure whether they're having a migraine or whether it might just be a sinus headache or sinus pressure. Typically, if you're having a sinus headache, you're going to a lot of times have a frontal headache. You may be tender in the sinuses here in the front. You may have almost a weighted feeling. You may have some nasal discharge or know that you've been having a sinus issue or allergies or a sinus infection. A migraine, it's not always black and white, but a migraine more often than not is going to be heavier on one side or only on one side of your head. A lot of times you'll have some tearing of the eyes or one eye. Sometimes your eyelids may close or one might be a little bit more closed than the other, and it'll tend to have more of a lightning bolt kind of a sensation rather than just that pressure. You'll also perhaps feel a throbbing, and the other thing that happens quite a bit, and people sometimes don't quite know that it's happened to them, is they'll get a little bit of loss of clarity and of cognitive ability, or their thinking. It tends to drop a little bit, and so you're not quite as aware of your surroundings and your mental processing. Like if you have to do a crossword puzzle, it's going to take a lot longer, and nor would you be interested in doing that, but it's that little bit of a mental slowing because the blood flow to your brain has been affected. A lot of people will, if they're aware early enough, they'll take something like an anti-inflammatory or lie down and in a dark place. Also, being sensitive to light is one of the biggest things that you'll note. So, lying down, using ice on their head, being quiet in a dark room can definitely help that. But people still struggle through it. They still, many of us are on medications. They still have the migraines. They have to take medication way more than they're comfortable throughout the month, and so forth. So there are a couple of things that we do just a little bit different here that can help the migraine situation. So one is, this is on a little bit of a longer sort of a preventative protocol, but is some IV therapy that helps support the brain and detoxes the brain, repairs the cell, can be just a game changer. In fact, I had one lady come to me because she wanted to get pregnant, and there's some things that I like for people to do when they want to have a baby, and we started on that protocol for her to help detox her as best and as quickly, as safe, and as fully as we could. And I didn't really pay that much attention to the fact that she had migraines because she was so focused on this other problem. But within a couple of weeks, I want to say 2 to 3 weeks, she said, "Look, Doc, I don't have migraines anymore. They've gone." And she said I was having one at least every 3 or 4 days that would last a day or two, which is absolutely debilitating in my opinion. And so she said, "Look, the migraines have got up and left. This is fantastic." So, but part of what we're doing is that we're restoring the health of the brain cell and cleaning it out of a lot of toxicity that people come in contact with. Most people are like, "Hey, look, I don't work in a power plant. I don't have any of that kind of situation." But our world is much more toxic than we really physically realize, because so many of these things are not really visible. For example, when you put new carpet down, there's toxins in the carpet. All furniture now that's made, I think past about 1975, has flame retardants in the furniture. Mattresses have flame retardant. Your new car smell is definitely a toxin. Perfume has lots of toxicity. Personal products such as hair products make up the whole thing. Even feminine hygiene products can have tons of bleaches and things in there, and so you're getting it from every which way. It's just that we're so used to it now, and because we don't really have a massive detector, unless you're very, very chemically sensitized, we don't have a way to really monitor that. But nevertheless, it ends up in the cell and it ends up in the brain very easily, and so getting those toxins out can definitely help in a number of ways. So that's one thing. So some IV and oral therapy to help repair and restore that. And then biofeedback It's one of my favorite devices to use with people because they enjoy it so much. They feel really good. It helps to sort of reset the electrical system of the body, and it helps entrain your electrical system and your electrical pulses to be more normal. So we are electric beings, and so when we can send in very healthy frequencies and the frequency of very good brain activity, our body wants to entrain with that, just like the pendulum on clocks in a clock shop. They want to entrain together. It's the same principle. So I love that because people feel well really, really quickly from it, and I don't have to worry about side effects. Plus, we can work on other things at the same time, just not sort of like migraines in a vacuum. The other thing that very quickly can help in the moment, or if you already have a headache, you think you're getting a headache, any of those, is our Nano-V device, which is sort of like inhaling an antioxidant, if that makes any sense. So what it does is when you create free radicals or you have oxidative stress, I give this example a lot, is say you've been on an overnight flight, you got delayed coming and going and landing, and then you sat on the runway, you're absolutely overtired, dehydrated, and you just want to go hide. Well, this can unwind that feeling and make you feel like you've had a nap and a shower and a great breakfast, within 10-15 minutes. So you can absolutely use it if you've had an overnight flight. Great, and I've done it. But if you have a migraine, it can really make you feel like you're almost inhaling a relief, or you feel refreshed in minutes. So I love that. And then the last thing that we can do is a little bit of an IV treatment. It's a different IV than I just talked about. This one is some Novocaine, which it sounds like, well, the dentist is going to numb up my gums. Well, it's the very first original local anesthetic that was invented over 100 years ago. And there's some qualities and properties to Novocaine as opposed to Marcaine and Lidocaine and all the other canes that people use. There's some very sort of magical properties to it, and it's very healing. And we use just a little bit of Novocaine, old-timey Novocaine, and a little bit of magnesium together in an IV, and it's very quick. In fact, I had an employee today absolutely just basically decompensate with a migraine that came on, and we actually put her on the Nano-V for about 10 to 12 minutes, and we gave her a little IV, and it wasn't even the full IV. We gave her maybe 8 out of 10 cc's or what have you, and within about 5 minutes she was back up and like she had never had the migraine. She felt a little tired and a little trembly, such as when you get after a migraine. It's sort of that, it's almost like a post-seizure kind of a feeling where you feel a little vulnerable. So she had that, which is not unexpected, but it knocked it out within 5 to 10 minutes, and it's so gratifying to do that and to have that sort of weapon against such a dreadful pain. So just something to think about. I hope you enjoyed this video. If you did, please subscribe to my channel. Visit us at handmadehealth.com or give us a call at 469-726-2737. Have a great day.